Hi everyone. So this video is going to be the first part, and what I'm going to do is I'm going to kind of skip around. So I'll do the beginning slides, I'll do the first feline disease, and then I'm going to skip over to the second like major feline disease, and then you'll have a second recording that goes into like canine cystitis, just because that's kind of how I set it up when I recorded the previous video months ago when I had to be out for something for AHA. So what we'll do is we'll kind of start here, kind of jump around. So just kind of pay attention to where I'm at on the notes. And then that way you at least get all the information. So it's going to be a little weird, but this is just kind of the best way so I didn't have to do another full recording of the entire PowerPoint. Um, just kind of sped things up for me on this side. So, the urinary system is made up of the kidneys, right? So there's two. The kidneys make urine, and then you have the ureters. There's two of those, and those carry urine from the kidneys to the bladder. So this would be the upper portion of the urinary tract, and then from the bladder down would be the lower. The bladder stores the urine, and then the urethra is the connection to the outside world, right? The main job of the urinary system is going to be waste removal. The red blood cell production, right? So you know that erythropoietin is produced by the kidneys, and then erythropoietin will go to the bone marrow and tell the bone marrow to make red blood cells. Regulation of water and electrolyte balance. If you think back to anatomy and you think of like that loop of Henle and how it all goes through, there's like different areas where reabsorption, absorption occurs. And then it also controls the blood pressure, which we will talk about on the next video. So the functions of the kidneys, excretion, right? So produce urine, maintain homeostasis, so that happy place, blood filtration, reabsorption, secretion, fluid balance regulation, and then acid base balance regulation. So again, this is going to have to do with like that loop of Henle, all the different connections. And then we just talked about hormone production as well. So we know that the urinary system is normally sterile and resistant to bacterial infections because they're avoiding urine, urethral and ureteral peristalsis, right? The glycosaminoglycans on the surface layer, right, of the bladder, it's actually a protein that kind of helps protect it from inflammation to an extent. The pH here, I just want you to kind of look at your ClinPath pH. This is the pH from the book in this class, which isn't the best. So I would prefer that you look at that one to get, better information, more accurate. I'm not going to ask you the pH in this class, but if you will need to know the normal range, right? I would go based off ClinPaths. So the first disease that we're going to talk about is actually a really sad disorder. The cats end up getting inflamed bladders, and then because of this, we start to see symptoms, right? So they start urinating outside the box, and owners tend to get really frustrated with this, and it's one of the number one reasons people abandon their pets, which is really, really sad because it's something that could easily be fixed, and it's just that lack of knowledge and sometimes the lack of them caring. So we have feline idiopathic cystitis. This is also known as FUS, which is feline urologic syndrome, or fluted feline lower urinary tract disease, right? And that kind of, with this fluted, blocked cats, bladder stones, like that kind of stuff falls into that category as well. So the facts here, it occurs in cats any age, really. Usually boy cats more than females. The cause is really unknown, but they're kind of leaning more that it's stress. So what happens is these kitty cats end up getting stressed and then their bladder becomes very inflamed. And so now they're going to start responding by urinating outside of the box or urinating in, inappropriate places. Not caused by a bacterial infection. It's really rare that a cat has an inflamed bladder caused by bacteria. It's more likely that it's going to be idiopathic. So we don't know what causes it, right? Or stress. And then reoccurrence is likely. So usually you look at like the history and you see if this cat has had a stressful like change, right, in the environment. And that usually is a good indication that they are responding to the stress by getting an inflamed bladder. So we can see polyuria, right? So passing small amounts of urine, but often hematuria, which would be blood in the urine. Dysuria means it's difficult to urinate. And then periuria. This is the problem. This is when people get frustrated. They'll start to urinate in sinks, tubs, the carpet, the chair, the bed. And this is when they start to get really frustrated. Another big thing is to make sure if you do have like a larger cat, that if they have a covered litter box, that they're able to get in it and turn around. My sister-in-law had this really big cat. Well, she still has him, but his name is Bing Bing. Anyway, he's like a 26-pound cat, 26-pound cat, right? Um, and she had a covered litter box, and he could not actually get in there and turn around. So that was part of the reason he was having issues, is because not only did they have another child and his litter box was like in a very busy area, but also because he couldn't really get in his litter box. So sometimes that's the problem. So diagnostics, urinalysis, culture to rule out bacteria. Like I said, only 1 to 3% of the time, it's caused by bacteria. It's more likely it's not going to be. It's more rare when you do see it caused by bacteria. You're like, oh, wow, that's actually happening. Radiographs to rule out bladder stones, since they could fall into this category. You want to make sure that the bladder stones aren't causing the bladder to get very inflamed. Avoid unnecessary antibiotics, because most of the time it's not going to be a bacterial infection. Change diet from a dry diet to maybe a wet diet. Cats literally only drink enough water to survive. And so providing them with additional water sources, like feeding them wet food, is sometimes the only option. Reduce stress from other cats, kids, provide hiding places. They tend to like cat trees that are up high. Pheromone therapy. I'm real big on the fill away. I feel like the fill away plugs, the sprays, those really do make a difference for cats. Before I had my son, I actually put in the fill away plugs. I got the spray so my cats wouldn't stress out when he was born, and it seemed to help. Um, Behavior modification drugs. So you can put them on antidepressants. It's just sometimes they get a little stoned off of it. So owners don't like that either. Glycosaminoglycan replacement. So Cosequin or Adequan. So these are like joint supplements, but they help with inflammation. They have like that natural inflammation, right? Or anti-inflammatory that helps with inflamed bladders. So here's the fill away. There's a lot of options. There's the spray, there's the plug. And so I feel like kind of using both in a combination is helpful. The disease is self-limiting. As many as 85% of cats will have resolution of clinical symptoms, usually in 7 to 10 days. Maybe a reoccurring problem. And then there's really no definitive cure. They do have this Science Diet Hill CD stress, and I'm going to play a video of this. The videos lag a little bit, so kind of bear with me. But this video is really great because it explains the importance of this diet and how it really helps not only with reducing stress, but even kidneys or even bladder stones, which tends to be like the main cause of blocked cats, which could be life-threatening. And so I feel like this prescription diet is like awesome. I'm a firm believer that prescription diets make a difference. Um, so I feel like it's really helpful for these patients. It's expensive, but if it helps with the problem, it's worth it, right? Because just reducing the stress sometimes is not an option. So I'm going to go ahead and get this video ready. All right.
Feline lower urinary tract disease is a disorder in cats that can be extremely stressful for pets and their families. In fact, inappropriate urination associated with FLUTD is one of the most common reasons owners give up their cats to shelters. FLUTD is not a single disease, but an umbrella term to describe a host of urinary tract conditions, the most frequent causes being feline idiopathic cystitis, struvite stones and plugs, and calcium oxalate urinary stones. Because signs can be easily mistaken by owners as misbehavior, Diagnosing the specific problem and recommending the right food can make all the difference to help your feline patients feel their very best. That's why there's Hill's Prescription Diet CD Multicare, the only nutrition clinically tested to dissolve struvite stones in as little as 7 days and reduce the recurrence of FIC signs by 89%. Now let's take a closer look at how CD Multicare works to help manage FLUTD causes like FIC and struvite and calcium oxalate stones and crystals. CD Multicare is clinically tested to reduce the recurrence of FIC signs by 89%. It contains powerful omega-3 fatty acids, EPA, and DHA to help reduce inflammation and break the inflammatory cycle, as well as antioxidants, vitamin E, and beta carotene to help counteract oxidative stress in the bladder. Clinically tested to dissolve struvite stones in as little as 7 days, CD Multicare uses controlled levels of magnesium, ammonium, and phosphorus, and a target urine pH of 6.2 to 6.4 to help discourage and reduce formation of struvite stones and crystals. Too much calcium and oxalate can increase the risk for calcium oxalate urinary stones. CD Multicare has controlled amounts of calcium and oxalate and added potassium citrate to help decrease the formation of calcium oxalate crystals and the risk of stone recurrence. For your feline patients, recommend the single solution to manage the most common causes of FLUTD, Hill's Prescription Diet CD Multicare. For more information, visit hillsvet.com or call Hill's Veterinary.
All right. All right. So again, that's why I show that video. I feel like it's really important. I do feel like it's helpful for the kitty cats. All right, so we're going to skip canine bacterial cystitis. That's going to be on the other video with majority of everything. We're going to go ahead and skip to the feline disease here. So feline uroliths and urethral plugs. So plugged or blocked cats commonly seen in small animal practice. So the two most common causes would be of that urethral blockage is uroliths or the urethral plugs. So uroliths are composed predominantly of minerals, right, which turn into stones. And then depending on the size, we'll kind of talk about the anatomy. And then urethral plugs is going to be the matrix. So mucoprotein, red blood cells, white blood cells. So if you look at this picture, I'm going to skip ahead really quick. This is the anatomy of a boy cat. It's a disaster. So you have your bladder here, you have your urethra, and you see that it looks normal. But once it gets here, it starts to get really small. And so as it goes down through here, that opening is so tiny that stones get stuck and then they get blocked. And that's really dangerous. And so it's really just comes down to their anatomy, which is awful. So we'll kind of talk about like what we can do for these cases. So we have that hematuria. Sometimes if they're urinating, we can see blood in the urine. We can see difficulty urinating as well. That's going to be like a big thing. That periuria, right? So again, like in places that are inappropriate, beds, floors, anorexia and vomiting, we're going to talk about that, especially if we see azotemia. I'm not sure if y'all have covered azotemia yet, but in ClinPath, you should go into more detail. But basically, when an animal or when a cat gets blocked, they're unable to urinate, right? And so sometimes they're unable to urinate. Sometimes they're completely blocked, and there's no urine coming out. So what happens is, since this is occurring, they can't void the urine, they can't get rid of it, and then basically toxins will build up. And so that's azotemia. So it's just toxins building up and it makes them very sick. And then as it progressively gets worse, then we can even see like urine spilling into the blood. And that's just a whole different situation that's very, very dangerous. So collapse and death can occur. We're also going to talk about that. When they're fully blocked and they can't urinate, potassium is not excreted like it should. And so basically we have a elevated amount of potassium in the blood, which is really dangerous because too much potassium can cause your heart to stop. too little potassium can cause your heart to stop. So we need just the right amount of potassium. And so sometimes we're playing with potassium here, and high levels of potassium are very dangerous. So we'll talk about that a little bit more. Non-specific signs would be hiding, crying while urinating, frequent trips to the litter box. These are things that owners might not notice, which is valid. I don't know what's happening half the time with my cat either. Um, right now, she's the only one I got, so she seems like she's fine, but I never really know, right? So I completely understand. So uroliths can be found anywhere in the urinary tract, formed from minerals in the diet. Some are radio opaque, right? So this means we can see them on a radiograph, calcium oxalate and struvites. Um, and then some are radiolucent. So cysteine and urate, these are the ones that they usually require some sort of visual like technique, right? So we have to give them some sort of like an injection that will light up on the radiograph. I want to say, I'm not going to ask you, but I think urate is the one that is questionable. Like we've gotten kind of back and forth. Um, if urates are actually radiolucent or if they're radio opaque. Um, I'm going to look now for you guys. Um, because the books was saying like two different things. Like it was saying that it wasn't, and then it was saying that it was. Um, so that one I'm not gonna really test you on. We just kind of need to look more into it. The VTE shouldn't ask you that either, especially if there's going to be controversial of which one is like actually seen. For sure, though, the ones that are radio opaque, the ones you can see on the X-ray would be your calcium oxalate and struvite. We can definitely see those. Cysteine and urate, those are the radiolucent, right? So I believe urate, maybe depending, could be seen sometimes, but I shouldn't be asking you. I'm not trying to confuse you. I would know for sure which ones are radio opaque. So uroliths damage the bladder, making it more susceptible to bacterial infections. When they're inside, they're just kind of beating around on the walls, causing blood vessels to rupture, causing blood. Uroliths can cause blockage of the urethra. So bladder will fill with urine, kidneys will stop working, and the patient may become azotemic, right? So toxins building up. So here it's just showing you hemorrhage in the bladder surface. So from it kind of bouncing around and hitting the sides of the bladder, and then it's showing you a plug at the tip where it's blocked. So diagnosis, palpation of bladder. Obstructed bladders are full and tight. Radiographs may show uroliths. Ultrasonography, you can stick an ultrasound on there. Urolith analysis is necessary so we can see what type of stone they are. Sometimes they look really similar. And then we do throw an EKG, so that rhythm, we can see atrial standstill, bradycardia, right, due to hyperkalemia. So this is what I was talking about. So these cats, when they're blocked, their potassium gets really high. So that's hyperkalemia. And high potassium will make their heart start to slow down, which could cause their heart to stop. How we treat it, I'm going to show you a video, is we can actually take insulin and we can give a cat insulin. When we give a cat insulin, insulin will open the cells and pull, and glucose will go into the cells. Glucose will also take potassium with it. This means that we have less potassium floating around in the blood. Yes, we could potentially cause this patient's glucose to get really low, but it's a lot easier to just give them dextrose and get their glucose back up versus trying to fight with really high potassium. So that's kind of the thought process behind it is you give them insulin, it opens the cells, glucose and potassium go inside of the cells, and then we can just give them the injection dextrose to get their glucose back up to normal. So it's kind of a process. So we are going to watch that. It's going to be an @Dove video.
Hi, I'm Megan. Today we're going to talk about hyperkalemia. This cat presented to our emergency room with a urinary obstruction, and cats that have urinary obstruction and dogs as well can have lethally high levels of potassium. Potassium is an intracellular ion. It belongs inside the cells. That's where things are safe. When we get high levels in our circulating blood, that potassium can cause damage to the heart muscle, and we can see some fatal cardiac arrhythmias from that. So what we need to do is try and get that potassium shoved back into the cell. It's important to get started lowering that potassium level right away before we want to put this cat under anesthesia to unblock him so that he can urinate. So what we can do for that is to first give them an injection of calcium gluconate. Calcium gluconate isn't going to do anything for the potassium levels. What the calcium gluconate is going to do is going to help kind of form a protective barrier around the heart to keep those potassium ions from damaging the heart muscle. Calcium gluconate should be given slowly. You want to have an ECG hooked up to the animal, or at the very least, listen to their heart because it can cause bradycardia. So once we've protected their heart, we need to start lowering that potassium level. We want to give them IV fluids to help dilute it out. What we can also do is give the animal an injection of insulin. What insulin does is it opens up the cells and allows them to use glucose. So when that cell opens up and it starts using glucose, it's going to take that potassium ion with the glucose into the cell. So by giving this cat an injection of insulin, we can drive that potassium into the cells, lower that circulating potassium number, and make them a better candidate for surgery. In some cases, you're also going to need to follow with dextrose. So they may need to be on a dextrose drip for a few hours after they've received that insulin injection, and they should have their blood glucose checked every couple hours to make sure that we're keeping up with that. But it's much easier for us to deal with a cat that needs glucose supplementation than it is to deal with a cat who has lethally high levels of potassium. So on every obstructed cat and dog that comes into the hospital, if they can't urinate, it's important to measure their electrolytes, keep an eye on that potassium, and make sure that we get that level low enough that they're a good candidate for anesthesia.
All right, so that was hyperkalemia, kind of giving you an idea of what we can be dealing with. So we kind of have to stabilize them first. So treatment, if they're non-obstructed, dissolve struvite uroliths by acidifying the urine. Feeding diets low in magnesium, just because struvites are made of magnesium. Should resolve in 4 to 8 weeks. Re-radiograph and continue diet 1 month after uroliths are gone. Usually, if they have occurred at all, they want to keep them on the diet forever. You could do a cystotomy to remove stones. So going in, cutting into the bladder and removing them. And then antibiotics would be used according to Coltrane sensitivity. So feline uroliths, urethral plugs, this is going to be some of the foods that we could give. There's lots of options depending what the doctor decides. Medical treatment, if they're obstructed, this is a medical emergency. We need to use less anesthesia in azotemic cats. When they're azotemic, they have toxins building up. They're not processing things the same as they would if their kidneys were working. So that's why. Pass the Tomcat catheter and back flush. And then you sew the catheter in place for 1 to 3 days using a closed system. Cats are a little bit more complicated than dogs just because they have to be sutured in. And so it can be quite frustrating, especially if they get their e-collar off or around it and they're able to chew it out. You have to sedate them each time. And it's just a little more frustrating. So we're going to watch a video here in a minute to kind of show you like what it looks like to unblock them. And so you can see here, this is kind of just showing like the back flush to unblock them. And then this is what a urinary catheter will look like on a kitty cat.
I'm Dr. Lee Harold, one of the critical care specialists here at Dove Lewis, and this is Humphrey. This is the second time, he's a second offender urinary obstruction, and we're going to unblock him and place an indwelling urinary catheter today. We're just getting him sedated with an injectable propofol protocol. He received oxymorphone and midazolam as a pre-medication. We're going to lay him in lateral recumbency. Cats can be deobstructed in dorsal or lateral recumbency to access the pipe use. So we'll just clip and sterilely prep his perineal region. He has some bruising from his previous deobstruction. I generally use the glove paper as a small sterile peel. We'll open our catheters onto there. We're using a Refrench Tomcat catheter, polyurethane urinary catheter for the deobstruction. You want to make sure to use quite a bit of lube to assist your deobstruction. To extrude the penis, you just want to push back kind of upward toward the perineum. Some cats are a little bit harder than others. He is of generous body condition, so he's a little bit more difficult. You want to seed the catheter at his distal penis. Once the catheter is seated, you do have to straighten out his penis because cats have a sigmoid flexure. And so if you don't straighten it out by pulling his prepuce back, it will be more difficult for you to pass the catheter. And we'll just flush his bladder with sterile saline, empty it out, and then we'll place an indwelling urinary catheter. I generally do not keep the polyurethane catheters in because they're a bit stiff and can be traumatic to the urethra. So the indwelling catheters that we use are just of a more flexible, softer material to keep in place for 24 to 48 hours. If you needed to get a urine sample, you would want to try to get it before flushing and adding any saline to get representative urine chemistries and strips on it. So we'll pass this slippery Sam urinary catheter. You can see it's very flexible. So it's made of a nicer material to be kept indwelling. We do with these catheters sink them all the way to their entire length. This is a 3.5 French 14 centimeter. Most cats require a 14 centimeter to get in a good position within the urinary bladder. And we pass the catheter the same way as the Tomcat. So extrude the penis, get it seated at the distal urethra. Straighten out the penis, and then just gently pass it into the urinary bladder. We have several attachments that help us to connect our closed collection system. This is a little Herbert adapter that will connect directly to the catheter here. You can attach the closed collection system directly to this female piece. I like to place a T-port on there because the T-port allows us, one, a portal to flush if we need to flush it, and also has a clamp if for any reason we need the bladder to fill up with urine during the course of hospitalization. And in Humphrey, we'll take a radiograph after we have secured the urinary catheter just to ensure that it's in the right position, it's in the correct position. It also allows us to look for any radiopaque uroliths. The slippery Sam catheters on this hub have 4 locations to suture directly to the prepuce. I generally place two sutures on opposite sides of each other is sufficient. We'll add some saline into the bladder just so that we can make sure the bladder is full for our radiograph so that it's a more diagnostic film. So this is Humphrey's urinary catheter placement radiograph. We just take a single lateral radiograph. You can see the radiopaque slippery Sam catheter here, and it's seated right at the neck of the urinary bladder. So when he's awake, that should provide a fairly good drainage. You can see there's an air bubble centrally within the urinary bladder from flushing and urinary catheter placement. I don't see any obvious radiopaque uroliths sitting in the urinary bladder. And so that's a good diagnostic film, and so I'm happy with that placement, and we'll just connect him to a closed collection system and secure the closed collection system to him, and then it'll stay in place for generally 24 to 36 hours depending upon whether or not the urine is really hemorrhagic or gritty. And then we'll remove the catheter at that time and see how he does. Through that entire period of time, he'll be on IV fluids to encourage diuresis and bladder flushing.
All right. So that's how you place a urinary catheter. You kind of saw how complicated that can be. Um, the next thing, if this becomes something that happens more than once, chronic obstructors, they will do a PU surgery, so perineal urethrostomy. Basically, they create a new opening for the urethra proximal to the narrowing. And so it looks similar to like a female cat. Urethra opening looks similar, like I said. The goal of surgery is to decrease the likelihood of that threatening obstruction. So you can see here, like this is the portion that they remove, and then they kind of like take the urethra and kind of suture it. There's a video on here that you guys can watch on your own time, but basically, like when they cut that, they kind of suture it to the sides, and basically now the opening is wider so the kitty can pass urine like they should. Um, so again, this is what it'll look like afterwards. And usually they don't respond negative to this because they were so uncomfortable prior. They're just able to urinate now, and they usually will leave they'll place a urinary catheter and leave it in place for at least 3 days afterwards. So, and just kind of make sure that they're passing urine. And so surgical patients should have IV fluids for that hypotension, dehydration, electrolyte imbalance. All those things occur when they're under anesthesia and a body cavity is like being cut, opened. So that's something to consider. So this is the video that you can watch on your own. It's kind of long, so I was going to kind of hold off on it because it lags so much. But that's really it. So that's how we're going to treat these blocked kitty cats. So the other video will go more detail into the canine conditions and like kidney failure, that kind of stuff. This one was just more focused on these two specific diseases, which are kind of like the more difficult ones. Sorry, my cat has gotten involved. If you had not noticed her on the screen, hopefully you're just looking at my PowerPoint and not me getting beat up by her tail and her in my face. Yeah, again, so this is specifically just like the cat ones, and then the other ones should be covered on the second video, which you guys should have access to. All right, and so that's really everything, and we can jump to the next video. So you can watch that one as well. Remember, that was a previous one that was recorded. So, I look a little different just because I was, it was different time. It was like months ago. So I'm like wearing something different, and it's not the same video, but it does connect all of them. So you have all the information, and that's it.